Hi, today's video topic is IBS, Irritable Bowel Syndrome. This Irritable Bowel Syndrome is completely different from IBD, Inflammatory Bowel Disease. As the name says, Irritable Bowel Syndrome, it's a collective symptoms called Irritable Bowel Disease, Irritable Bowel Syndrome, where people have sometimes present with abdomen pain. It could be light pain or even sometimes crampy severe abdomen pain, and they will have a constipation or diarrhea, bloated sensation. This IBS can really disturb their day-to-day life activities. It could be sometimes it will be mild. Most of the patients may not even know they have IBS, but when it affects their day-to-day life activities, then it becomes a very serious one. Why? What are the causes? Causes generally we say it's all because of, our GI tract is made up of muscles. These muscles, when they overreact or beyond the capacity, they can get all these problems. Or sometimes it's with the nerves. So the nerves are the one which control the rhythmic movements and everything. When the pulse is incoordinated, the impulse is incoordinated one, this can happen. And this can happen with sometimes even allergies, food allergies, gluten sensitive intestines, all this can cause. And anxiety or mental diseases, like some people are a little anxious. These people have IBS, suppose father, mother or somebody, the family history is there. These also are the reasons for IBS to happen. And what are the usually how the doctor or the surgeon or the physician come to a conclusion that somebody has IBS? Usually it's a disease of exclusion. They will exclude all the other reasons. So there is no specific test, no specific diagnostic procedure to say that you have IBS. So the surgeon or the physician first, they will rule out all the exclude all other possibilities. Like they will ask for a history, then they will physically do examination, and then they may ask for certain blood investigations, or even they will ask for endoscopy, colonoscopy, sigmoidoscopy, CT scan. All these things, when they do and everything comes negative, that means everything is normal and the symptoms are there. Then by exclusion criteria, the physician comes to a conclusion that somebody is having IBS. Usually the crampy pain, bloated sensation, diarrhea or constipation, which happens at least once a week over a period of at least 3 months, with certain criteria. There's a Rome criteria. There are so many criteria. With that, the physician comes to a conclusion that you have an IBS. Okay, what to do with the IBS? If it's a mild, there's no need to worry, and most of the patients, they may not even aware that they have an IBS. But when it's really disturbing, or when it went to go to the doctor, so if the pain is so severe, you have a nighttime severe pain or diarrhea, mucus discharge, iron deficiency anemia, and your day-to-day life activities is really disturbed, then definitely they need to see a gastroenterologist. And the treatment part comprises, you can say broadly classified into 3 parts. One is diet and lifestyle, then maybe probably psychological counseling, then medical treatment. So most of the time the gastroenterologist asks you to change your lifestyle. Like probably they'll ask you to take a high fiber diet, take plenty of water, and avoid certain foods. Some people may not be happy with some food. It can trigger their thing. And any gaseous food like broccoli, cabbage, cauliflower, these are also to be avoided, they will say. And some people, gluten, even the wheat or beans, these can aggravate or trigger this thing. So this diet part has to be taken care. And they will ask you to go for regular exercise. Exercise is really good in controlling the IBS. And if nothing works, then probably you may require sometimes counseling, how to de-stress yourself, how to get out of your anxiety, and and some people, because of the IBS, they go for depression, so that also has to be taken care. And if diet, exercise, lifestyle, nothing works or nothing acting effectively, then probably certain medications that doctors can prescribe. So if you have IBS, nothing to worry, first thing, because these IBS can be kept under control. It cannot be cured completely. It's a long-standing disease which needs your lifestyle change, your diet, some medications. So consult your gastroenterologist and just follow his advice. For each individual, the gastroenterologist can change their approach. So what suits for you may not suit for others. So don't come to a conclusion, okay, the other person has this treatment, so I should also have the same treatment. No. And most of the people sometimes ask, who will get that IBS? So generally we say if you're below 50 years, if you're female, females are twice more prone for IBS, and you have a genetic predisposition, suppose parents, if somebody's having. So these are the people who can have this, or mental diseases, or they are taking medications for mental problems. These are the people who can get IBS. So consult your gastroenterologist and have your own treatment from him. Thank you.